I think we are reaching the end of our agenda today, and exciting to know that we have a funding dialogue facilitated by Jessica Gorham, the Regional Emergencies GBV Advisor and co-chair of the Regional GBV Working Group for East and Southern Africa. So over to you, Jessica.
Thanks, Camilla. Can you hear me well?
Yes, very well.
Excellent. Good. It's nice to see everyone again. I was briefly speaking to all of you this morning. As Camilla said, my name is Jessica Gorham, and I'm really happy to be facilitating this donor discussion this afternoon. As I mentioned this morning, understanding the needs of men and boys is really important to us here at the GBV AOR, specifically our team in East and Southern Africa as well. So I'd like to introduce our panel. We are really fortunate today to have some really strong advocates joining us to talk a little bit about this issue from a donor perspective. So I'd like to welcome Elizabeth Devlow, who is the Humanitarian Protection Advisor based in Johannesburg, working on behalf of BHA. And maybe Elizabeth or Beth, if you could say a quick hello so we know that your sound system is working well.
Hi, hello. I hope you can hear me.
We can hear you well, and thank you. We also have Corita Tassi, who is the thematic expert on protection and gender at ECHO. We're really happy to see you here as well, Corita. So if you would like to also just say a quick hello so we can make sure your sound is working.
Hello, good afternoon, everybody.
Perfect. And then lastly, but not least, we also have Vanessa Prinz, who is joining us from the German embassy in Addis, whose focus is on public affairs and human rights. And we're really happy as well to have someone from the German embassy and representing the German government, who I hope we all realize is also now the global lead for our call to action for GBV prevention and response in humanitarian settings. So the process today, we will ask 2 questions for each of our donor representatives. We will ask a similar question for the first one, and then we will have a unique question for each of our donors as the second question. And then we will have, we hope, a little bit of time for us to field questions from our participants in the chat. So please feel free to write your questions in the chat, and I will try, as well as I think some of my colleagues, Christine and others, if I miss any, I will try and monitor those questionings so that if we do have a little bit of time at the end, we'll be able to also do those. So thank you again for all of our panelists today for joining us. It is really much appreciated. So the first question, and maybe I'll start with Corita, who is joining us from ECHO. The first question is about can you tell us a little bit about ECHO's policies around inclusion or your focus on male and adolescent survivors of GBV?
Thank you very much, Jessica, and I'm very honored to be part of this panel and this symposium. As you know, and we all agree that women, girls, boys, and men are affected by crisis in different ways, and this is why the European consensus on humanitarian aid recognizes that these and the European Commission policies on gender, age, protection stress the importance of providing assistance that is tailored to the specific needs and capacity of each gender and age group. So the purpose of gender-sensitive humanitarian actions is to support all vulnerable groups according to their specific needs, and this is at the core of the EU, the European Union humanitarian aid mandate, to support needs-based operations on a non-discriminatory basis. And the Commission supports a broad understanding of gender, which does not only focus on women and girls, but also takes into account the different needs of men and boys. To support also the effective gender and age-related commitments, ECHO introduced, as you might all know, in 2014, introduced the gender age marker, the so-called GAM. And the GAM fosters a system that is more sensitive to the differentiated needs and capacity of all groups. So during ECHO internal periodic evaluations of this gender age marker, it's noticeable that the criterion on gender analysis is where the greatest improvement has been made. However, the criteria on adequate participation and mitigation of negative effects still encounter some challenges. This is why for us it's very important that and all eco partners are really expected to continue consistently applying a holistic and inclusive gender sensitive and risk informed approach to inform all humanitarian interventions. And gender perspective should be incorporated from the very stages of a crisis response, so to understand and effectively respond to the differentiated needs and avoiding excluding certain groups or putting them at risk. The risk analysis should remain and is at the core of any humanitarian action funded by DG ECHO to ensure effective decision making and evidence-based response and advocacy. This risk analysis should look to the specific needs, threats, other vulnerabilities and capacities of all different population groups, including men and boys, of course, avoiding generalization and assumptions. So it is expected to be a continuous process that can inform programmatic decision. And one-size-fits-all approach, we have seen also today, simply proves to be less effective or even to do harm. So we are here today because we all agree that men and boys can and do experience gender-based violence, including sexual violence. So different characteristics of male survivors, particularly age or diverse sexual orientation, gender identity, expression or sex characteristics may impact the way in which the seeker are provided the support. So this is why there is persistent gender stigma associated with gender-based violence for male survivors, and this compound complexity in disclosing, ensuring safe and inclusive access to services. So treatment and care should be addressed by service providers who are appropriately trained and able to offer care that is survivor-centered, non-stigmatizing and non-discriminatory. And it is important to understand in the specific context how men and when men and boys disclose their experiences of sexual violence. And it is important that this information about accessible entry points for male survivors is provided to the community. So while it's still necessary, and ECHO really advocate for this, to have and to keep women and girls oriented services, it may be necessary to consider additional and different entry points for male survivors. So from the ECHO perspective, despite the numerous steps forward to ensure better and more efficient tailored assistance to the specific needs of different groups within the affected population, there is still a way to ensure that humanitarian responses are based on solid risk analysis and not generalized assumptions, and particularly on impact of the humanitarian crisis on different gender age groups. Thank you.
Good. Thank you so much, Carita from ECHO. And I'd like to hear that it's being institutionalized throughout all of the project and proposal assessments. And I think that's key to really understanding risks and vulnerabilities. So we appreciate that feedback. And I'm sure we've all heard of a gender marker, and it's interesting to hear that ECHO has adapted a sense of that same gender marker. So Vanessa, I'm going to ask you a similar question. If you could talk a little bit about the German government's commitment to focusing on or understanding the needs of male and adolescent survivors better.
Yes, thank you very much, Jessica, and thanks for inviting me to this panel. It's very good to be here today. And yeah, it's very reassuring to hear about the gender marker of ECHO. Germany has a very similar approach. So we also have a gender marker for all of our measures in the field of humanitarian assistance. We gather data on gender, age, and disability, and we've done so for the past 4 years, I believe. And since this January, we have adopted a feminist foreign policy approach. So that means that all of our foreign policy measures must be either gender sensitive or gender transformative, and all measures must be assessed against the background of how they provide or change the rights, representation, and resources of all genders in relation to each other. So that is a background, and more specifically to gender-based violence in emergencies. That's one of the priorities of Germany's humanitarian assistance. And there we focus on two areas. The one is a survivor-centered approach, and the other one is enhancing accountability. So for the survivor-centered approach, that means that we focus on the needs and on services and of survivors, of all genders, and their access to remedy. And I would like to talk a little bit about what we actually implement in order to support this policy. And that's first of all, with regard to accountability, we fund the UN Special Representative on conflict-related sexual violence and her team of experts on the rule of law and sexual violence in conflict. We also work with survivors organizations, including the Mukwege Foundation and Nadia's Initiative, as well as with survivors networks. Some of them here in the region, including in Uganda and in South Sudan. And we also support civil society and UN organizations, among them UNFPA, UN Women, UNICEF, as well as ICRC Special Appeal, where we happen to be the biggest donor. And altogether, last year we earmarked 25 million euros for gender-based violence in emergencies related projects. So I feel that Germany is doing a lot in this area, and I wanted to introduce with that because I went through our projects that we're implementing currently, and I find it striking that despite this remarkable engagement that I feel we're having in this area, there is very little awareness of and action towards boys and male adolescents as survivors of gender-based violence. So I couldn't find a single GBV in emergencies project that was directed specifically towards boys and young men. And I also suspect that many of the measures that were targeted towards survivors exclusively meant women and girls and their children. So I think that both awareness raising and action towards an intersectional and gender-focused approach is necessary on many levels, including among donors and among implementing organizations. And just two thoughts, and I'm finishing with that, two thoughts on how we can include gender-based violence response targeted towards all genders, truly targeted towards all genders, more strongly in our policies. And one, Jessica, you already mentioned, it's the call to action that we currently chair. It can help to raise awareness, call for funds, and coordinate joint action. And I propose, well, in early June this year, we hosted the annual partners meeting where we assessed the implementation of the roadmap. And I propose to give more regard to all genders and to differentiated approaches. As has been said, there is no one-size-fits-all approach, and it should be part of the next roadmap. That's the one thing. And the other thing, also specifically to donors, we're funding a lot of funds and general funds. So one of them is the UNFPA's Humanitarian Response Fund to provide GBV and SRHR to services, and we should focus more strongly on including a differentiated approach in these funds and their activities. Thank you.
Good, thank you. And what's I think really struck me is that there's an assumption maybe that these types of programmings aren't being funded, but I think you're also changing that narrative a bit and saying we're not actually getting proposals that are inclusive of prevention and response mechanisms for targeting adolescent boys and children. I'm going to ask the same question over to Beth from BHA. If you could just take a couple of minutes to also show us or tell us a bit about BHA's commitment or your focus on the needs of adolescent and male child survivors.
Okay, Jessica, and I just want to confirm, is there a second question coming after this, or am I answering both?
There is.
Okay,
Yeah,
then
there's a
we'll-
second question.
Yeah. Okay, got it. Thank you so much. And I'm having a giggle because I think I'm just going to say a lot of the same as what has already been just spoken. And it was such a pleasure to listen throughout today. I think there's a lot of so since the Darfur response in 2004, BHA has been prioritizing and increasingly prioritizing quality service delivery, particularly to respond to sexual violence in GBV. And we also have taken a real targeted look. It's very true that our primary focus has been on women and girls, and we do recognize that there are other survivors, or as was spoken about earlier in the day, those who choose to refer to themselves as victims, often slipping through the cracks. And particularly to this population we're speaking of with adolescents, we definitely recognize that we need to apply the learning that we have gained within the GBV community, the child protection community, across health practitioners, PSS practitioners, et cetera, to better address sexual violence among the total population that are impacted, and that includes boys and men, persons of diverse genders, et cetera. This is complex to really be able to address these various needs, and very much in agreement that we have a long ways to go in terms of knowing how to uniquely and specifically address needs across our total populations represented. Our way of working is through the framework called Safe from the Start revisioned, and Safe from the Start was, if any of you had heard of that, has been revised, and this is 2.0. This framework does center on women and girls once again and takes a feminist approach, but we definitely emphasize the inclusion of all survivors, including men and boys and diverse genders. And we believe that all survivors or victims are deserving of safe and quality services, and we work to ensure that. We are supportive, very much so, of GBV and child protection actors working together and developing frameworks at the field level, as you just saw, the field cooperation framework. We think that this is absolutely key. And if we're trying to look for a very simple way forward, we just want to see a continuum of care between all of the service providers that would be involved in this space. Also very much agree with what was spoken earlier. We want to prioritize more and more, or we have recognized the need to prioritize building of capacity, because there is a lot of there's a lot out in the various spaces. This particular niche, I would say we still need to develop, as has already been said, models and approaches, but we definitely need to make sure that the guidance that is available is well disseminated, that those receiving it completely understand it. So we have supported Cassie, as said. We're also supporting various in country level spaces, various projects that have been quite innovative to include these diverse populations. And let me stop there for now. Thank you.
Actually, Beth, because I think you brought up a lot of key points that might reflect into your answer to the second question. So can you tell us a little bit about, because I'm sure that there's lots of proposals that are reviewed and submitted to BHA, just generally in a few minutes, can you tell us what you think are some of the gaps that you see from a donor perspective in terms of our ability to adequately address the needs of male adolescent and child survivors?
Absolutely. And that's such a great question. So to be honest, we rarely see the specific demographics of survivors called out in our proposals. So often, I mean, at the most, we might see child and adolescent survivors, but we wouldn't see any further breakdown. So again, this is where we look to our partners to identify who is it that they are looking to address. And we very much recognize that we need to do a better analysis of who is truly in need in context by context and who is potentially falling through the cracks. We also recognize that we do not want to necessarily say that targeting adolescent boys is simply the responsibility of our typical GBV actors. We recognize that that, again, is a area of specialized expertise. And we really hope to see entities who are skilled in addressing these populations, partnering with our partners, or being pulled in for their expertise. And this again goes to that idea that we do need to look at what are the models that work in these various spaces. We note particularly that, again, the responsibility doesn't simply sit with GBV. It's GBV, it's child protection, it's MHPSS, it's health. So as we look at the various sectors who hold responsibility, we are very interested to see who steps up. And that's someone mentioned, I think it was Karita who mentioned earlier, there are entry points across the sectors, and there are a variety of ways that we can respond. We do know that we do not want to change the models that work for women and girls. We'd rather bring on add-ons of what also works for adolescent boys, et cetera, et cetera. So we're not trying to invite boys into a women and girls safe space, but we're trying to specialize our programming also to them. And I think what we have seen is in some cases, when pushed, staff who have not yet been capacitated are nervous or not comfortable to respond to the broader needs. And we have to recognize that and accommodate that as well. We've seen, I mean, we definitely, like the Women and Girls Safe Space, and like Girl Shine, we'd like to see these models created for men and boys, diverse genders, etc. And I think just finally back to the idea of really now leaning in on ensuring that capacity is there and at the very local level. We just want to see that whatever guidance comes out going forward is as absolutely practical as possible. And yeah, I'll stop there. Thank you.
Thank you. So lots of good themes that are coming out. And one, I think, across a few of what you've said is the need for specialized programming being implemented by providers who have the skill set to do it. As I think many of our speakers throughout the day have said, that this is a distinct group of survivors. So thank you for that. And we have about 5-6 minutes left. And so I'd like to ask Vanessa. One of the objectives of the global call to action is to ensure that GBV services and programs are in place at the very start of an emergency. How do we ensure that all donors understand the importance of developing programs that specifically address the needs of male and adolescent child survivors? Is there something that we can do as a community through the call to action?
Yes. So a couple of thoughts on this. So one of them, I would like to go back to this survivor-centered approach, is to include survivors as key contributors into all humanitarian planning. And these survivors need to include all affected groups of all genders across an intersectional spectrum. We also need, I believe, to more strongly understand that GBV affected persons are not a homogeneous group. So we need to analyze intersectionality and also cater to their different needs. And last but not least, we need to strengthen accountability and end impunity with regard to all survivors, so not just to women and girls. And in asking how to best achieve this, I would like to point out 3 things. So I already talked I already talked about the call to action and how it can help to raise awareness and to shape global programming that can result in more effective and more inclusive intersectional responses. But also, I think that as a donor community, it's important for us to continue to coordinate with host countries and to reach out to local communities to help to address the stigma surrounding GBV against boys and male adolescents. And that brings me to my last point. When Germany chaired the Humanitarian Resilience Donor Group in Ethiopia last year, we organized an event on GBV in emergencies in the context of the conflict in northern Ethiopia. And our aim was to raise awareness among the donor community that the protection cluster is one of the most underfunded clusters, at least in Ethiopia. So as long as this huge gap between needs and funding persists, funds will always go to the majority of those who need it, and they continue to be women and girls. So in effect, gender-focused intersectional approach also depends on the availability of sufficient funding. Thank you.
Thank you, Vanessa. And this actually is a great segue to our last question. And it's a bit of a tricky one. So, Corita, this is kind of on your desk right now, but developing a GBV response services that specifically address the needs of male survivors has often been seen as controversial. And I think this is what Vanessa was intimating a little bit as well, because it is believed to somehow minimize the needs of women and girls who we do know are overwhelmingly affected by gender-based violence. So we also know that donors not only provide funding, but are important agents of change in terms of advocacy. How can we leverage the donor community to kind of change this way of thinking on a global scale? Not an easy question, I realize. Over to you.
Thank you very much, Jess. And well, as you know, it has never been a controversial topic for ECHO, as we have always advocated for the inclusion of male survivors in humanitarian responses on gender-based violence. So it's been, we are very happy to be here and to have these discussions now, and we definitely will continue our support towards this direction. As of today, we have growing evidence that GBV, including sexual violence, is perpetrated against men and boys too, and is exacerbated by humanitarian crisis. So in the past, the GBV community has successfully advocated and demonstrated that the gender-based violence takes place and that life-saving assistance to female survivors must be available since the onset of the crisis. As ECHO, we believe and we strongly advocate, and this is for us one main entry point, is that the same narrative should be used for male survivors, and actually should not be, as also Beth was saying, should not be including male survivors in the existing GBV responses for women and girls, but to add on and to ensure that also services for them are available and entry points are available for them. So we should, as a community, move away from the strong assumptions on who can be a survivor of gender-based violence. Humanitarian actors should become more gender and diversity inclusive in their operations. And to do so, we should also move away from siloed approaches, which focuses on gender, age, disability, protection in isolation in silos. We should aim at moving towards a more intersectional approach, able to assess the compounding vulnerabilities of different groups within the communities we serve. So male survivors of gender-based violence may experience sexual violence alongside other forms of violence and deprivation. Therefore, definitely risks should be addressed through holistic, integrated, and targeted protection actions, addressing a wide range of identifying needs. We still see a lot of fragmented and silent responses, and this is definitely counterproductive to our cause. And so not only targeted actions, but also the systemic mainstreaming of gender consideration, which goes beyond, of course, as also for ECHO and the European Commission, just women and girls, but it's really men and boys and all diversity spectrum. So it's for us, it's a crucial for effective programming to have this mainstreaming of gender consideration, and a matter of also of compliance with the European Union humanitarian mandate. So finally, I think that one of the, and we had an example just before this session, is that to ensure effective integrated response and protection of male child and adolescent survivors, we should reinforce evidence and coordination efforts. So we welcome all the initiatives like the amazing ones that have been presented today, but overall there is still the need to further push and operationalize on the ground a common approach between the gender-based violence, the GBV actors, the CP actors, vis-a-vis children and adolescent survivors. It has often been fragmented, as we said, between those two sectors and area of responsibilities. The referral pathways for male survivors should be reinforced and systematized, and the capacities, as already mentioned several times, of GBV and child protection actors to handle male survivors should be systematically addressed and strengthened. Hence, the close coordination and partnership with the protection cluster, the child protection and gender-based violence areas of responsibilities, the mental health and psychosocial support working groups, the health sectors, and all the other also sectors are crucial to an effective response for female and male survivors of sexual violence. And then lastly, but well, not last but not least, this coordination must meaningfully include the participation of national civil society, without which accountability and locally owned solutions cannot be achieved. So the European Union really recognizes and advocates the active participation of all gender age groups and their associative solutions in humanitarian aid as essential, and because, of course, we strongly promote this involvement. So this is not, I don't have the silver bullet to the question you asked me, but definitely you have a very strong ally and advocate in ECHO. On this matter.
Which we appreciate. Thank you, Carita. And I think our time is coming to a close, but I want to take away some key points I think that were raised, and we're kind of cross-cutting through each of our speakers today. One is the lack of representation from a donor perspective in terms of just one, understanding the specific needs of male survivors, adolescent and child survivors, and then understanding even in proposals and projects that are submitted, we're not seeing the level of detail or even the representation, as I mentioned. I also appreciated that you all mentioned the need to engage at country level and also at local and with our civil society organizations, so that we have buy-in and we have accountability, which is also really key, and to change the way maybe this narrative and how we think about survivors. And so lots of good things to think about. And so I want to thank very much, Beth. Thank you for joining us. And Vanessa and Carita, it was really great hearing your thoughts and reflections, and we're really happy that you were able to join us today. So thank you so much. And I think, Carita, lastly, you mentioned intersectionality, and we can't say enough about the intersectionality pillar of our regional GBV working group for East and Southern Africa, because they are the ones who launched and organized this symposium along with our partner organizations. And I think you're exactly right. It sits in intersectionality. And so we're really thankful that we have so many great people and experts in the region who are helping to get this out at a much higher level. So thanks again, everyone, for joining us for this donor panel. And I'll turn it back over to, I'm thinking, Laureen, over. Or Christine.
Thank you, Laureen. Kindly take it up for the last closing session. Thank you, Jessica, for the amazing session.